Hi, this is Stuart Talley. I'm here today to talk about the Stryker LFIT V40 head that's used in hip replacement surgeries. One of the questions that many people have asked us is what types of tests should their surgeon be performing? If they have one of these hips, they're having pain in the hip, what should be done? Well, it's important to understand what's happening. If you have cobalt and chromium coming off your hip, what it does is it causes soft tissue damage in the hip joint. So it can destroy the muscles, the tendons, the nerves. Many clients will go to their doctor reporting pain, and he'll take an x-ray and tell you that everything looks good, and maybe it's coming from your back. Maybe the pain has nothing to do with the hip. What's important to know is that those x-rays aren't going to show what's going on inside the hip because it's a soft tissue injury that's occurring. So there are two tests that surgeons typically perform if you have problems with your hip. The first thing they'll do is a blood test. And the blood test will test for the amounts of cobalt and chromium in your blood. When cobalt and chromium comes off the hip, it'll actually be released into your bloodstream. And cobalt and chromium is measured in what they call parts per billion. So it's a very, very sensitive measurement. Normal cobalt and chromium in people with prosthetic hips should be less than 1 part per billion. So if you have cobalt levels that are higher than that, that means there's something going on with your hip. That means it's releasing cobalt and chromium into your body, and it should not be doing that. So that's the first step. Find out what your cobalt and chromium levels are. The second step is they will do a special MRI called a Mars MRI. And when I say it's a special MRI, what I mean is that it's an MRI that can be done when you actually have metal present in your body. It's very difficult. The traditional MRI is very difficult to see anything when there's metal present. But this type of MRI overcomes that problem of having metal present, and it can detect fluid accumulation, it can detect soft tissue damage in the hip, and it can also see if there's something called pseudo tumors in the hip. Pseudo tumors are the body's way of reacting to these metal particles. So if you have those three items to look at, sort of your pain level, your cobalt and chromium levels in your blood, and an MRI, that's usually what the doctor will use to diagnose whether you need a revision surgery, which means surgery to go in and replace the defective ball with one that's not defective. So if you have any questions about the process, about what your doctor should be doing, we're not doctors, but we have a lot of experience with hip clients. We have several hundred hip cases in the firm, and we've gone through a lot of medical records. We can tell you what other surgeons are doing. So if you have one of these hips, feel free to give us a call. You could reach us at the phone number on the screen. You can visit our website and fill out one of our online forms, and a lawyer will call you right back.